You're listening to Thyroid Talk with Dr. Angela Mazza. Welcome. I'm Dr. Angela Mazza, a thyroid, endocrine, and metabolism specialist with an integrated practice in Central Florida. Today's topic is stress and its effect on the thyroid. As our listeners know, my goal for this podcast is to define and demystify the thyroid gland and thyroid-related medical conditions. By providing information in an easy-to-understand format, I hope to help patients better understand the ways in which their bodies work and help them thrive. I'm glad that Dawn Sheffield, my friend and co-host,
and patient,
is here for me for episode 10.
Thanks so much for inviting me back. I know our topic today is stress, and we're going to get to that shortly. But before we get started, I hear that we got a valuable listener comment we'd like to respond to.
That's right. Here's a comment from a listener in Orlando, Florida. In episode 8, we talked about thyroid hormone replacement. And we talked about how some people actually take their thyroid hormone medicine at night. So this listener wanted to point out that she takes it at night, always 2 hours after a meal, but she does it so she prevents her from snacking later on in the night, which I never even thought about before.
No, and that is such a good idea. And frankly, I hadn't either. And I know folks wonder a lot about when to take their medicine, the pros and cons of different times of day. Friends of mine have talked about that to me. And patients don't always get clear instructions or explanations or even think to ask, the question. So there's confusion about how long to wait before or after drinking and eating. And I think that was really helpful. So I'm glad that listener wrote that in. That was good.
That was excellent.
Yes, it was. Happy. I'm delighted to have gotten to record with you today. But speaking of stress, that traffic,
oh my God.
Not today, but very recently, I came close to being T-boned by a huge pickup truck. Same day, I was inches away from being sideswiped by a different driver. And in both cases, quick reaction time saved me, I think kind of just barely. But after each new encounter, I felt simultaneously hyper alert, relieved, scared, incredulous, a lot of incredulity, and I was enraged. My eyes were wide open, hunting for more danger. My breathing was rapid. For me, other drivers, distracted drivers, are stress-defined.
No kidding. Modern life is absolutely packed with potential sources of stress. They're everywhere. Like hypercritical bosses, unrealistic deadlines, absurdly heavy workloads, especially in this day and age, upsetting family issues, health problems, economic pressures, just to name a few.
And from what you have studied and written about, our bodies and how they work have not really changed since our primitive cave-dwelling days. So what has changed?
Well, it's the types of stressors we face. So instead of a carnivorous dinosaur with massive teeth trying to chase us down for dinner, we have inattentive, distracted drivers.
There you go.
And family issues that may threaten to swamp us, physically and emotionally.
Modern life can present myriad emotional challenges like loneliness, health problems, debt, and the perceived lack of meaningful social groups.
We are wired the same as we were when cavemen. But back then, if we were trying to get away from a bear, we either got away or we didn't. Either way, the stress was over.
There you go, that's right.
If you really think about it, even in not so distant times, most humans likely did not live long enough to worry about long-term lingering or complex problems. Wounds, accidents, and illnesses, they really had only a few treatments or cures. I guess that's both the blessing and curse of modern medicine.
Do you mean that we did not live long enough back then to get the terribly debilitating diseases we can tend to get now, especially as we age?
Yes, that's right. There was drama back then, but it was short-lived. Like humans were. But our stress-inducing issues these days tend to be long-term and not easily resolved, like caring for both children and an aging loved one, or finding employment or affordable housing. The examples are absolutely endless. There's a great book called Why Zebras Don't Get Ulcers by Robert Sapolsky that tackles this topic. I highly recommend this book if you have time to read it. I'll put the info in the episode notes.
And some stressors might be very similar between primitive times and now, like finding comfort or enough to eat.
Quite possible. I'm gotta add that not all stressors are bad stressors. Some stressors can motivate us and push us to succeed, like acing a big test or nailing our dream job.
I agree with that.
Yeah. Good stress is usually short-lived and gets us excited. It gives us energy. But bad stress is usually more long-term and totally wears us out. Bad stress is difficult to recover from and can have a negative effect on our bodies, particularly our thyroid.
The thyroid seems to take a disproportionate hit in so many ways.
I know.
I never used to even imagine it. With stress, it's the hormone, a steroid called cortisol, that can have such a debilitating impact if it's unbalanced. To get us all on the same page to start this topic, what would you like to say about stress and cortisol? What's the most important thing we should know?
Cortisol is a hormone that's produced and released because of stress. Our body doesn't know the difference between different types of stress. For example, our body reacts no differently to the stress of surgery, illness, or a broken arm than it does the unexpected loss of a loved one or a nasty divorce. The end result is cortisol helps manage the situation at hand. Stress triggers cortisol. So cortisol is created by our adrenal glands. The adrenal glands are small glands that are positioned right above each of our kidneys. Of all the hormones our bodies produce, cortisol is number one in importance. Thyroid hormone is crucial too, but it takes second place to cortisol. We cannot live without cortisol, but too much or too little, that lack of balance presents a big problem for our bodies. When balanced properly, cortisol is crucial to our metabolism and to our strong immune response. It also helps our bodies to manage our responses to the various sources of stress we face. To begin on a very basic level, the adrenals have two main sections, and each of the two parts produce different hormones. The two parts of the adrenal gland are the outer adrenal cortex and the inner adrenal medulla. The adrenal medulla makes what we commonly refer to as adrenaline. You know how people talk about when they feeling when they do something exciting like jumping out of an airplane or bungee jumping, crazy stuff, and they felt this adrenaline rush. I myself would never do anything quite as dangerous. I think I might die of a heart attack first.
No.
That would be too much adrenaline. But sometimes when I find that specific pair of shoes, which I've been searching for months, I think that might be the equivalent. It's quite a thrill.
It really is. Get that 100%. And some people may feel that way about shoes or fabric and books and other stuff too. We don't have dragons now, yet it's a conquest of sorts.
That's right, a modern one. Now the adrenal cortex has 3 different layers. One layer makes the precursor hormones for male and female hormones. One makes aldosterone. That's an important hormone to keep our blood pressure up. And the last layer is responsible for making cortisol, our star hormone for this conversation. It can be very complicated. So to simplify it, I'll just say that the adrenal glands produce various chemicals that serve myriad functions in our bodies. Each half produces different chemicals. For example, blood pressure control and that hyper-alert, hyper-vigilant reaction you described after that near accident.
Mm-hmm.
Those chemicals, hormones actually, are released at the start of a stressful situation. You may feel your heart really pounding and find yourself panting and wide-eyed as you did those almost accidents.
I did.
That's a chemical reaction caused by the adrenal glands. Like we said, we're going to focus on cortisol in this episode, and it's crucial to our stress responses.
What amazes me is how many aspects of our well-being are improved by cortisol when it's properly engaged, and how much we can be negatively impacted by it when it's out of balance.
That's because, in part, so many of our cells have special receptors that are sensitive to the effects of cortisol. So the effect it has on us can depend upon which type of cells are being activated and affected. Its effects are systemic, meaning cortisol can impact our entire body, from blood sugar regulation to metabolism and to providing anti-inflammatory effects and way more. The thing about cortisol is that it's time dependent. By that, I mean this hormone is produced all day, but should reach its lowest point around midnight. Then it should start to rise again dramatically by early morning. But its crucial timing gets easily interrupted in its normal functioning by our 24/7 work schedules and our 24/7 off-the-chart stress levels. So the normal necessary production schedule for cortisol may be disrupted. That is, our cortisol levels become dysregulated, unregulated, not controlled. This is because modern life doesn't always allow for dependable sleep cycles and bedtimes. And again, it offers lots of long-term stress our primitive bodies aren't prepared to handle. When cortisol is uncontrolled, insulin resistance can go up. Just one night of messed up sleep can show alterations in insulin the next day. And insulin resistance can lead to prediabetes and type 2 diabetes if left unchecked. You know when people gain weight, especially in their midsection? Well, that's insulin resistance. When insulin is high, we are in a state when our bodies are storing glucose, and that's where that widening midsection comes from. That is more than likely contributed by cortisol dysregulation.
It's interesting to me in that primitive and ancient people may have had at least one advantage over us, and that is when it got dark and cold. I'm imagining it was likely easy to go to sleep.
Probably.
It's dark, there's no electricity, and to conserve their energy. And they were not expected to perform 24 hours a day like, say, for example, our modern factories, our news cycles, not to mention entertainment. They did not have the sustained pressure, the heat, the lights, all the distractions and attractions that we have. And they were probably exhausted, I imagine,
right,
from the hard physicality required just to stay alive.
Like trying to hunt and kill the meat-eating dinosaurs that were trying to kill them. Not to mention somehow store the meat, if possible. I don't know where they would store it, but...
I don't either. And I'm not sure. Now I'm just suddenly thinking, I'm not sure if there were dinosaurs.
I don't think there were dinosaurs in cavemen.
I'm thinking that we're thinking of large animals, large meat prey animals, but in my mind I was originally thinking a lot about dinosaurs, as I often do. So yeah, that part might not be 100% accurate. We're not experts on that. I don't know.
It's imagination.
It's creative license right there.
But you know what? They also didn't have cell phones attached to them.
No, that much we know.
That's for sure.
Because there are none have been found to my knowledge. So anyway, that's right. And my cell phone, for example, is as big a threat to my getting to sleep as a bear or a bison. It has to sleep. Actually, my phone has to sleep in a different room, so I don't have access to it.
That's probably pretty smart. Well,
desperation, and can't hear or see the distractions that it provides, quite frankly.
Well, that's good.
Well, it had to happen.
It has its own room.
Mm-hmm.
We mentioned earlier in this episode that lots of our modern stressors can keep us awake. The lack of sleep is yet another source of internal stress that can wreak havoc on our bodies. Our sleep patterns can alter our cortisol patterns, and in turn, cortisol can affect our sleep. Too much cortisol might make it too difficult to sleep, and too little cortisol might make us want to sleep too much.
In the last 2 years or so, I've come to not only better understand the importance of regular sleep, but I've had to accept its importance too. For me, understanding and acceptance are different. Acceptance led me to make a few healthy changes in that regard. Like a lot of folks, I used to feel way more creative at night, or you know what, I'm gonna say that differently. I perceived that I was more creative at night. I'm only talking about myself here. I greatly enjoyed the late night time to myself after everyone else turned in. It felt really special, almost mystical. It was my time, when nobody else's needs had to be met. But once I learned that sleeping more and more regularly helps us in myriad ways, including with weight loss, I had to revise my thinking. I've now had to carve out other times and ways in which to have that me time. Sometimes that means withdrawing from an activity or an engagement that I would have previously participated in, or that I might have been expected to participate in. And that might disappoint someone when they hear I'm not joining in, but that just has to be okay with me now.
Well, it can be a huge challenge to carve out some sleep and self-care time. But what a literally life-altering positive impact it can have. The thing is, if we don't make the effort, the effects of too much cortisol can be truly debilitating. Hypercortisolism is the condition of having excessive cortisol levels.
Some of the symptoms of that, a few of them anyway, remind me a bit of hyperthyroid, and that is overactive thyroid.
Yeah, there are a few similarities. Here's a list of common symptoms of excessive cortisol. Again, that's called hypercortisolism. Listeners can probably recognize those symptoms that are held in common with hyperthyroid, but they're not all the same. In general, possible signs of excessive cortisol may include feeling tired, weight gain, particularly in the abdomen region, high blood pressure, anxiety, depression, feeling irritable with mood swings, headaches, distressing GI problems, irregular menstrual symptoms, erectile dysfunction and low sex drive or libido, sleep difficulty, slowed recovery from exercise, muscle weakness, and increased thirst and urination.
Well, that's quite a list, I must say. And of course, like with so many other conditions, excessive cortisol also can impact thyroid function and thyroid hormone production.
It is a long list, isn't it?
Yeah, it's crazy.
The thyroid does really face many challenges. That's why we try to promote doing everything we can to protect it. For instance, with excess cortisol, the thyroid can experience an inability to create adequate amounts of the thyroid hormones that it must make for our health. It can also make us unable to fully utilize micronutrients that are crucial to thyroid function, like tyrosine, zinc, and the extremely important selenium. And too high cortisol levels can affect more than just our thyroids. For example, other crucial organs like our pancreas, our brain, our heart, gut, and even our mitochondria, the powerhouse of the cells. Right?
I do
can all be negatively impacted.
Yes, I do remember that, yes. What happens to our bodies if our high stress levels are maintained that way over time, as they often are these days?
If we are under high stress levels for a long period of time, the part of our brain called the hippocampus just can't tolerate it. It's like our brain is on fire. This leads the hypothalamus and the pituitary to decrease the releasing hormones that stimulate the production and the release of cortisol from our adrenal glands.
Can we actually burn up, or use up, maybe I should say, our adrenal glands over time, causing them to stop functioning? Because I think I've heard or read that somewhere.
No, that was a very common misconception for a long time. That led to the term adrenal fatigue.
Yes, I've heard that.
It's not like the adrenals are tired or anything. They're just like need a nap.
That's a sad image.
There's really nothing wrong with the adrenals in the situation. It's the axis that is off. We now use the terms HPA axis dysfunction. APA stands for hypothalamus pituitary adrenal, or we also use the term hypoadrenalism. And there's another term, hypocortisolism. So essentially, what can start out as too much cortisol transitions into too little cortisol.
And let me guess, the thyroid can also be harmed by too little cortisol hormone. That wouldn't surprise me at all.
It's true, sadly. The thyroid is affected by too little cortisol, just as it can be by hypercortisolism. First, let's cover the general possible signs of cortisol that's too low in the body. So, there's fatigue, you might feel dizzy, nausea, and some belly discomfort, weakness, either weight loss or weight gain, and again, decreased sex drive or decreased libido, and erectile dysfunction and menstrual irregularities.
In either hypo or hypercortisolism, are there one or two symptoms that you find more often drive a patient to seek help?
Unfortunately, people tend to seek out help more often for hypoadrenalism, which is on the tail end of the spectrum of cortisol change. A lot of people can function very well with too much cortisol, and they don't really realize they don't feel great. They feel like they're getting things done when cortisol is high, but once cortisol is low, they can't function.
Testing for adrenal gland function must be crucial because so many of the symptoms of adrenal dysfunction, as we said earlier, may look similar to those of thyroid dysfunction.
That's right. Adrenal testing is very important to determine the problem accurately. And yes, some of the symptoms of adrenal gland dysfunction do resemble thyroid problems.
Can any doctor, say a family general practitioner, test our cortisol levels, or do we need to see a specialist to interpret the results?
Really, any healthcare provider can check cortisol levels, but you might want to consult a specialist who can interpret them well.
How do you test to see if our cortisol is too high or too low?
Well, you can do blood tests for early morning cortisol, but that's just a snapshot in time. Really, the best way is by doing salivary cortisol testing over the course of a day. Basically, you collect 4 samples of saliva in tubes provided by your laboratory at 4 different times of the day: 8 a.m., 12 noon, 4 p.m., and 10 p.m. So ideally, we should see a cortisol curve, with the 8 a.m. cortisol being the highest and the 10 p.m. cortisol being the lowest. People with normal cortisol show this beautiful curve throughout the day. Some people show high all day long. Some people show low all day long. Some people show a downshifted but normal shape curve, and some show like a backwards curve. But really, the worst curve is the one that's low, flat all day long. These are the people who are just flat exhausted. This is the result of the brain not being able to handle long-term stress. It's almost a protective measure. Now, people who show the backwards curve usually are folks who have trouble sleeping and are tired all day. They often refer to themselves as night owls. But whatever you call it, it's really not healthy.
Yeah, that's my not very good impression.
It was very good.
No, not today. I didn't nail it. I can do it in the car, but that's my very bad impression of a barred owl, not barn, barred, B-A-R-R-E-D. And well, as I said, that's what I was, a night owl. Cuckoo. That's what I called it. Cuckoo, cuckoo. There you go. I've heard other creative folks say they are night owls too. And I know my habit on this was formed in my childhood, so it was a formidable foe for me to conquer as an adult. Change came, but it was incremental, with a little bit of backsliding along the way, of course. The thing is, I felt I still functioned fine in the daytime. I wasn't even sleepy, despite those owl-like habits. And that's part of why I saw no reason to change, and maybe other people experience that too. It wasn't that I resisted sleep. I just wanted to be awake, to do things, or to enjoy the silence. And, those are different things.
Hey,
and again,
makes sense.
Yeah, I was looking for some me time. I'd often feel I'd been so busy during the day I'd not connected with myself. And like so many of us, I had to be outer directed, not inward directed. So my needs could go unmet, I think, many times without me even noticing. And I think I'd stay up late to try to recoup some of what I felt I'd lost. Now, of course, this is in retrospect. I didn't realize that at the time. It was never a conscious decision, really entirely subconscious. Eventually, though, I did start getting so bleary-eyed at night, it was no longer enjoyable at some point. And eventually, I'd find myself waking up, sitting straight up with a craft or book still in hand. And still I resisted changing for a while. But you know what? That's my habit, as we've learned on this show.
Hey.
So as a result, I'd like to better understand the thyroid-cortisol connection in general. I know only that thyroid hormone is famous for affecting, maybe controlling our metabolism. And you've mentioned it can also metabolize other hormones, including cortisol.
What we mean when we say it metabolizes other hormones is this. In episode 5, titled Lab Test Results, What Do the Thyroid Numbers Mean?, we discussed the so-called half-lives of medicines. We talked about how the body breaks down, uses the medicine, and clears it from the body. The same is true for hormones. They're only active for so long, then they are broken down. Some parts are recycled to use for new hormone production, then the other parts are cleared by the liver. The thyroid helps in this breaking down, recycling of some parts, and clearing of other parts of hormones. So imagine if your cortisol is already low. You have that bad, low, flat cortisol curve. If more thyroid hormone is added to the scenario, say by adding thyroid hormone replacement or increasing thyroid hormone replacement, that already low cortisol is going to get even lower. Pretty common situation I see is this. A person is fatigued. Their physician thinks it is due to hypothyroidism, but the real issue is low cortisol. So, the doctor goes up on the thyroid med, and the person feels even worse. That's why it's always important at least once to check cortisol when dealing with someone with hypothyroidism.
I'm always trying to steer every chat around a leaky gut, as you well know. Do you think that leaky gut, that is, a too permeable intestinal lining, is caused by sleep interruptions that disrupt proper cortisol levels?
Well, not exactly. It's not a straight line. But amongst one of the consequences of high cortisol is possible leaky gut. Cortisol can be catabolic to the gut lining. That means it can contribute not to building it up, but to dismantling it, tearing it apart in a metabolic sense. Cortisol can disrupt the happy, precise placement of the cells of our gastroepithelial lining. It can negatively affect our good microbiota, letting the bad microbiota run wild. Then what happens? We know that this can lead to inflammation in our internal system, and the immune system can start to misrecognize our own tissues, leading to, amongst other autoimmune conditions like Hashimoto thyroiditis and Graves' disease, our autoimmune thyroid diseases. So, if our sleep is off, cortisol levels can be high, and in that way it can lead to leaky gut. As I said, not exactly a straight line.
In episodes 8 and 9 in particular, we talked about the importance of gut health. As a little recap, one of the things we've discussed on this podcast is that the gut and our immune systems are deeply connected. But as we've said, too much cortisol can cause our gut's lining, the gastric epithelial cells, to become too porous, too permeable. This causes imbalance in the immune system of the gut, causing us to become more prone to autoimmune disorders and to food sensitivities too.
Right. And again, that's why balance is critical. And just a reminder, autoimmune means a condition in which our own immune system mistakenly identify our bodies as invaders. It needs to attack and kill as it would a virus, for example. So in Hashimoto thyroiditis, for instance, our immune system attacks our thyroid. With vitiligo, it's our own skin cells that are targeted, causing patches of skin that are free of pigment so they become snow white, in contrast to the rest of the skin. Although we may have predispositions that are genetically related to certain autoimmune conditions, leaky gut could be the part of the catalyst to actually develop these conditions.
Just a quick interjection here, circling back to sleep and weight loss. It's never easy for me to lose weight, but I was shocked by how much easier I felt it became when I started going to bed at a regular time and getting adequate amounts of sleep. It sounds so counterintuitive, doesn't it? By resting you could lose weight.
I know.
But I'm just talking about myself. That's been my experience anyway. And I think in part losing weight became easier because, for one, I wasn't awake and, cruising the refrigerator, eating leftovers or so-called, or foods that weren't nutritious. And also I think I wasn't having cravings during the day as much because my sleep was disrupted. But now when I was, getting regular sleep, I just didn't so much experience that. And I think the balance in my system overall was improved. And, over time I feel like the desire to overeat or maybe eat in ways that weren't so good for me, they kind of faded away. It became easier to resist foods that weren't rich in nutrition. And I feel that's all tied up with cortisol levels. And I want to say, too, this did not happen instantly.
It takes time.
Wow. I'm looking back over time. I'm not at all implying this was some kind of instant effect. It wasn't.
In fact, you mentioned to me the other day that your house, you are now known as the quote-unquote sleep leader.
That's right, buddy.
What does that mean?
I don't have a badge, and I think I should. I think I should have some sort of
like a hat or something.
Some kind of marker. Unlikely, it seems, but now I'm the one watching the clock. I am the sleep time monitor. And with a few exceptions here and there, of course. I'm not all rigid about it, but we don't start a TV show, though, for example, if finishing it will keep us up past a certain time. I'm just kind of pay attention to that now. I thought I'd meet resistance at home about this, but no. I was really surprised. In fact, I think there was some relief, possibly. I go to bed at a pretty regular time now. Every night I do let myself read in bed. Paper, not electronic. If I'm not sleepy right away, I don't just, grind my teeth about it. I just let myself read, and I'm going to get sleepy, I think, because I'm in the right place at the right time.
That makes sense.
So it doesn't take too long to drop off. And sometimes I use a meditative breathing technique that helps me to focus on my breathing, and that's usually the last thing I remember. It just does the trick.
La La Land.
Yeah. Mm-hmm. So regular listeners know we don't like to talk about problems without also discussing potential repair kits.
Of course.
What do you recommend your patients do to help restart, or maybe I'll say sort of reset their cortisol levels to be in the optimal range beyond changing our sleep habits? What treatments are available and how effective are they?
Happily, there are lots of things I can recommend, and consider these self-care tips to manage stress and thyroid health. Prioritize sleep, just like Dawn said.
There you go.
Practice that proper sleep hygiene by maintaining a regular schedule. Cut back on the caffeine. Cut back on the screen time. Decrease noise levels before bed. Aim for a minimum of 7 hours of sleep per night. Find an exercise routine that works for you. So it'll improve blood sugar control, cardiovascular health, and stress reduction. These are one of the many benefits of exercise. Try and stay connected. Staying in touch with loved ones is more important now than ever. Connecting with others reduces stress, increases self-esteem, and can even strengthen your immune system. You might want to consider making time for a new hobby. Pick things that you find fulfillment. Spend time developing new skills or exploring old ones. How about learning a new language or playing an instrument, something like that? Practice mindfulness and meditation. Incorporating mindfulness can be as simple as sitting still for a few minutes to focus on your breathing. These practices provide many benefits, such as improved sleep and reduced anxiety. And try and eat nourishing foods and stay hydrated. So limit your intake of refined and processed foods. Go for whole, fresh foods. And again, avoid caffeine, alcohol, and sugar.
I think we would feel remiss if we did not call special attention to the importance of connection and artistic endeavors to our own physical and mental health. And just FYI, when we say art and artistic, we include all crafts and hobbies as well as the fine arts. We feel they are all artistic expressions. Not everyone can be a Rembrandt, but could Rembrandt make a sweater or a crocheted basket? Maybe not.
I doubt it.
Me too. We don't know, but guessing here, but bet you not. I've benefited in myriad ways from hobbies, with most of the benefits being unexpected. Like me, you may find some crafts to be remarkably meditative, and that can help with the mindfulness Dr. Mazza mentioned. You can take group classes, share your interests, grow a skill. Many other hobbies too lend themselves to personal relationships, that connectivity that we need. So you have that added bonus. In my experience, those things can easily flow into doing your art for a charity. Groups exist for that too. It could even be neighborhood cleanup that interests you, and I've done a couple of those and I've had a really good time and met new people. It was fun.
Well, plus it benefits the neighborhood.
Yeah, it did. So it was good. Whatever it is, I look for emotional, feel-good aspects and newfound friends. My strongest friendships right now, and reaching many years into the past, have involved the fiber and fabric hobbies in some way. Some groups can be tremendously supportive, and by the way, these groups often exist virtually too. Ask a local shop or look on your social media, and you can start a group as well.
Some arts lend themselves to being done with a friend or a group. And if you make anything with yarn, you are a fiber artist, in my opinion.
I do.
Because I myself love to crochet. I started crocheting when I was a young girl, and I found it always calming, especially after a long day. Although I like the end product, it is just the activity itself that I enjoy, and it calms my brain. I encourage people to take time, even if it's for 5 minutes a day, to do something that brings them peace and joy, because that is healing to our brains and our adrenals. I'd like to hear from our listeners about your hobbies, crafts, and other artistic endeavors.
I'd love to hear about that too. I really like that detour into craft talk. I'd like to stay in that lane, frankly. And, in your spare time, maybe we just need to make a fiber arts podcast too.
There you go.
In your spare time.
In my spare time.
Yeah. But in the meantime, we need to be able to hear about the supplements and nutraceuticals that we mentioned to help with adrenal gland health and balancing cortisol levels so that we can all continue to create our art for many years to come.
I want to cover supplementation too, and I will. But first, a warning. As always, discuss all products you want to try with your healthcare provider before you start taking them. Why? Well, even natural, plant-based, organic, whatever, can interact with other medications or products you're already taking. Natural products can work. That's why we take them, right? But they can also interact with other substances as well as prescription medications you may be taking. And you might not need a certain product. Too much of something, no matter how natural it is, might cause harm. Here are the supplements I recommend to my own patients. I'll name them and explain those that may be unfamiliar to most folks. The first is ashwagandha. This is an herb that's well known for its calming effects, so high cortisol levels respond well to ashwagandha. Next is L-theanine. L-theanine comes from green tea extract, also very calming. This is kind of my go-to, like if I have a big presentation, I'm super nervous. I take a little bit of L-theanine. Doesn't make you tired, keeps you focused, but just a little more calm. The next is GABA. So GABA is our calming neurotransmitter. So like when our brain can't shut down at the end of the day, or you wake up and you start thinking about things at night and that messes up your sleep, GABA is a good thing to take. Again, it won't make you feel tired the next day. Rhodiola, chamomile, and lemon balm also are well known to calm cortisol that's running on high. CBD really can help with anxiety and sleep, but you got to be careful with the quality of CBD that you take, because pretty much everywhere you can see CBD. I mean, I think even the gas station down here sells CBD, so just be careful. It's kind of scary. There's some guy making CBD in a vat in his garage or something, so you got to be careful with quality.
Yeah, a little nervous there.
Cordyceps actually comes from mushroom. Again, very calming and good for HPA dysfunction. Magnolia and philodendron together are a great combination for sleep. There are adrenal extract blends, which are kind of like thyroid hormone replacement, but they're adrenal extract. So for people that have a super flat cortisol curve, in addition to other things, sometimes adding in some adrenal extract helps. And then finally, adrenal adaptogens. So adaptogens are really anything that help nourish adrenal function. So usually a combination of different herbals and other micronutrients.
How long do you think a person might try some of these supplements before getting their blood tested again to gauge the level of improvement?
I recommend trying any protocol for adrenal issues for at least 3 to 4 months before rechecking. Unfortunately, unlike the gut, healing this imbalance can take years. This also depends upon the severity of dysfunction. The HPA axis, or hypothalamic pituitary adrenal axis, takes the longest of all the axes to repair.
What are your most important takeaways for listeners regarding cortisol stress in our bodies?
Well, cortisol is the most important hormone we need to live, and I think we stress that. It is the highest on the hierarchy of substances we need for survival. When cortisol is either too high, too low, or just not right in general, it can have negative effects on our health. The bright lining is this can be fixed, and though it'll take some significant time, it'll be worth it. Listeners, you have our sincere thanks for sharing your time with us. I hope this discussion was helpful. Let us know. In our next episode, Donna, I'm so excited about this. You know I've been waiting for this.
I'm happy.
We're going to cover brain fog and the thyroid.
Mm-hmm. Good.
No foghorn.
I need that episode.
Well, I think so many people suffer from brain fog, so...
I'm sorry, what are we talking about? Yeah, I got it. I'm got it. Brain fog. All right, I'm good. We're good.
You're too much.
Got it.
I wanted to do this podcast to provide life-saving education and to encourage folks to see a doctor in time to prevent or minimize damage. That's deeply fulfilling. I enjoy helping folks understand how all aspects of their lives are tied to both thyroid and overall health. As always, my goal is to help us live more fulfilling lives by taking control of our lives and thus feel our best. In fact, this is why I went into endocrinology. It's a medical art that combines science with the study of our lives and all that they encompass.
We sure hope you'll continue listening to Thyroid Talk with Dr. Angela Mazza. We have many more interesting episodes planned. We'll build on today's foundation and cover many topics we hope you'll find meaningful. To recap just some of what we've covered here, and not necessarily in this order. What is cortisol? Why is it important for survival? We are wired the same as we were as cavemen, and zebras don't get ulcers?
What?
Right. Where is cortisol produced and released? Why is long-term stress worse than short-term stress? How the brain is affected by long-term stress and the effects on the adrenals? What symptoms are associated with too much cortisol and too little cortisol? How too much cortisol can cause leaky gut? How too much thyroid hormone is bad in the setting of hypoadrenalism? Lifestyle strategies for correcting HPA dysfunction? The value of crafting and creating and connectivity, a favorite subject, as well as nutraceuticals that may be helpful for fixing cortisol issues. But best of all, we learned that we can impact our thyroid health. As Dr. Mazza mentioned in our next episode, number 11, we'll discuss a subject that I really need to discuss, brain fog and thyroid. And as always, we welcome your input. Please send your comments, show ideas, and questions to thyroidtalk.mazza@gmail.com. That's an email address, not a message board. Other listeners won't be reading your messages on any sort of public forum. We may disclose your general location on air, the city or town, for example, but we will not read your name nor your address on the show. We reserve the right to edit your input as necessary. Don't forget to ask your healthcare provider about any specific questions regarding your wellness. This podcast is meant for educational purposes only.